One thing that we do know is 2028 really is going to be defined for how the two parties move beyond Donald Trump.
Election analysis from Amy Walter, one of the nation's top political forecasters, and the virus outbreak that may be responsible for 3 deaths on a cruise ship. This is Path News Network Daily Edition from the College of American Pathologists. I'm Nancy Johnson. It's Wednesday, May 6th. The CAP's Hill Day 2026 brought several key victories for pathologists. Bipartisan legislation to reform Medicare's local coverage determination is moving forward. Plus, 2 senators and 1 representative signed on as new co-sponsors of the Results Act that would stop Medicare cuts of up to 15% to clinical lab tests next year. Pathologists had 168 in-person meetings and 5 virtual ones last week with lawmakers. This effort will hopefully build relationships that will impact the profession and patients for years. The stakes for policy couldn't be clearer. Control of Congress after the midterms and ultimately the outcome of the 2028 presidential race will shape what actually gets done in Washington. I spoke with Amy Walter of the Cook Political Report at the House of Delegates and Pathologist Leadership Summit. Here's more from our conversation that didn't make it to air.
The midterms are often considered change elections, as we know, and the Democrats have been showing some strength in recent state races. And does that portend any meaningful signals on a national scale?
Yeah, it sure does. I think you're exactly right that midterms are traditionally a referendum on the party that's in power. What we also know for the last 20 years, almost every election we've had has been a change election. 2012 was the rare example of really no real turnover in control of either the White House, the House, or the Senate. Every other race since then has been change.
Walter says these change elections reflect 2 factors. First, the sentiments of voters in a deeply divided country.
A public that feels so disappointed and disillusioned with politics and politicians, feeling as if neither party is able to solve some of their problems. The second is a system now that is so polarized and cemented in that polarization that it doesn't take much of a swing in order for one party to gain or lose majority status.
Hill Day is over for this year, but the advocacy work continues as pathologists engage in ongoing conversations with lawmakers about payment reform, workforce issues, and access to care.
So we know that the party that controls Congress is going to have a huge impact on healthcare policy. And I know you talked to some of our member leaders earlier. I was in the room where you were listening to them talk about test costs going up and reimbursements going down. So how do we as a pathology organization prepare for what's happening politically? Like, what can we do based on the landscape as you know it?
Yeah, so much of what happens is, even though we talk about politics, we talk a lot about numbers, we talk a lot about data and big picture about this institution of Congress. But fundamentally, it's made up of 535 individuals. And knowing who your member of Congress is, interacting with that member, understanding what is happening in that district. Again, if you're a constituent, as many of the folks here are, of the member you're going to go see, talk to them about what matters in their districts, how this impacts their constituents.
And I asked Walter to dust off her crystal ball.
But what about the 2028 presidential race? And what do you predict in terms of turnout and interest then and what might happen? And is either party going to have a star who's going to emerge?
It is the zillion-dollar question. I will say this, we have had unprecedented level of involvement and engagement in politics for the last 10 years, driven in large part by one person, and that's Donald Trump. And for 2028, he is not on the ballot. And so that does become the next question, which is is this unique to Donald Trump? Was he the reason turnout spiked? Or is it that someone else who can jump in and also raise that level of interest, whether it's on the Democratic side or the Republican side?
And getting back to the Results Act, Senator Marsha Blackburn of Tennessee, Senator Steve Daines of Montana, and Representative Dina Titus of Nevada signed on to co-sponsor this legislation during and after the Pathologist Leadership Summit. They joined more than 80 of their colleagues already in support. You can send your action alert on the Results Act today. The link is in the show notes. 3 passengers have died and others are sick after a suspected hantavirus outbreak aboard a polar cruise ship in the Atlantic, according to the World Health Organization. Hantavirus is a rare infection carried by rodents and typically spreads to humans through contact with contaminated droppings, urine, or saliva, not through the kind of person-to-person transmission seen with flu or COVID-19. Early symptoms can look like the flu, including fever, fatigue, and muscle aches, but in severe cases, it can quickly progress to life-threatening lung or kidney complications. There's no specific cure, so treatment focuses on supportive care, making early detection critical. Investigators are working to determine whether the exposure happened on the ship or before the voyage. And finally, pancreatic cancer can stay silent for years, often coming back even after surgery because cancer cells evade the immune system. Now, researchers at the University of Rochester Medical Center say they've uncovered why and how to target it. In a study published in Developmental Cell, the team identified a gene called DEC2 that helps tumors hide from the body's T cells. The gene's activity even changes depending on the time of day. The discovery could help explain why some immunotherapies and even experimental vaccines work for only some patients and may open the door to more effective, precisely timed treatments. That does it for the Daily Edition. Be sure to check the show notes for more information on today's stories. Also, share this newscast with your social media network. We're back tomorrow at 5 a.m. Eastern for another episode of the Daily Edition. I'm Nancy Johnson. Have a great day.